Welcome to Adapt English. Somebody may ask, what is BESHARP? Well, in this video, I'm going to talk about English prioritization tips, the BESHARP method. This is an important aspect of the English, and it's crucial that you are as sharp as possible when it comes to prioritization. Without a strong prioritization strategy, it is easy to get overwhelmed and discouraged during the English because most of the questions are something to do with whether you prioritized or you're making a decision at the right moment. So in this video, I'm going to share with you some tips on how to do the prioritization using this BESHARP, and so that you can be confident when you're taking the exams. So let me show you what I mean to be sharp and not this. I think the way I see it is a versatile tool that will help you solve most problems. It cannot solve every problem, okay, especially prioritization, but it keeps you focused such that you stay focused when you see multiple answer choices. You say, I'm looking for something that is within this chart. And that is what mostly that will put the patient in a morbidity state. And so you make them not do well, you affect their function. And so you don't want that. And so we have a B basically talking about anything that affects breathing. So they may not tell you directly as breathing, but as you can see, we have a P, pulmonary embolism. That is, it has get into the lung and affecting your normal function, basically. And that is a breathing problem. You have to identify it. It may be somebody who had a DVT, that you have to see it and then recognize that, oh, this patient, I need to be sharper about it. Being sharp means you're looking at a patient twice. You said, I have to look at a patient twice and make sure I'm not missing anything. And somebody with pneumothorax, this can be, it can affect both the airway and breathing depending on what it's doing. If it's pneumothorax, actually, it's a parenchymal disease. It affects the lung itself. So that is a breathing problem. But if it develops tension and it pushes everything, it goes to airway and circulation. So the patient can have a fusion that can put them in tension, cardiac tamponade. All these things are important. They are buzzwords. When you see them, you say, this is a buzzword. It's on the BESHARP. I need to look at it among the patient if my patient has. And the pulmonary edema. And they won't tell you it's a pulmonary edema, but they will describe it somebody with the CHF as a pink fluid sputum. All pink fluid sputum, when they cough, there's blood in it. It means their lung is congested. The lung is drowning in the fluid. And then basically the blood vessels break down. And then when they cough, there's blood in it. So these are the buzzwords. You hear them. You said, I'm dealing with a breathing problem, and I need to be sharp about this patient so that I don't cause morbidity to that patient. Okay. So the next one is talk about electrolyte. There's key electrolytes, sodium, magnesium, calcium, and potassium. These are what control homeostasis of your body system. And whenever there's a decrease, either decrease or increase in their level, it changes your body function. So you got to pay attention. You can see potassium, usually cardiac effect. Calcium also has cardiac effect. Magnesium also both cardiac and muscular effect. And sodium is neurological. And so those things you have to start thinking. When you see them increase or decrease, you have to evaluate your option choices. You said, do I let this go? Or do I need to say something to the doctor or do something about it? Okay, the S is two form. You have sepsis and shock. So sepsis means they have temperature. Usually those are the triage of sepsis. So you have temperature, it will be increased. So temperature. So this patient have temperature and they may have fever. So they have hypotension. Remember, the temperature can be low or high temperature, so low or high temperatures. So a low temperature, you can have a temperature of 96. That is not good in a septic patient, and they may have changed in mental status. Okay, those are the things you're looking for. Or they have a wound that look infectious. Okay, patient has a wound with white count increase, yes. And the sepsis, the S shock, basically heart rate goes up or blood pressure goes down, and then day to they have changed in mental status. That's what you're looking for. So they will give you those things, but they won't tell you the patient is in shock. You have to put the numbers together and decide what it is. And the age talks about hypothermia. Like I told you, a patient who is hypothermic is a cardiac problem. I'm talking about like 96, temperature of 96, 95. You should start thinking, this is not normal. I need to do something about it. And hypoglycemia. So sugar, they will give you sugar 300, 500. I don't care about sugar. That is mostly hypoglycemia is the most because it affects your neurological function. Okay, neurological function. So like sugar, finger stick less than 60. Okay, then you start worrying about it. That this is not good. It's going to make the patient lethargic. Neurologically, they cannot function well, and then it become a problem. Okay, and then you move to the A, which is number one. Okay, of course, if you don't have air, you cannot breathe. So number one, you can function. So airway, and the airway is full of pathways. So restlessness. Okay, patient will be drooling. Okay, that's not good. They will be grunting. That's not good. Okay, they will have a stridor. That's not good. Those are buzzwords when you hear it in the who do you see or patient, they're describing a patient in the statement, and you see those things, your antenna should be going up and thinking about, I need to see this patient again. Okay, acute confusion, okay, can also come here. All of a sudden they confuse, they may be hypoxic. So confusion sometimes represents hypoxia, depending on the condition. Okay, so and that is number one, it's our style. So you got to be careful when you see that. They can give you multiple choices, but when you see A as an airway problem, then you have to take it. And the R is like neurological stuff, so neuro stuff. Okay, so a patient who had a seizure right away, you got to control their airway and then check their neurological status so that because they can't protect their airway because of the seizure that they have. So these patients are very important. They may be lethargic. And the reason why they are that is because the brain is not functioning well. Okay. And then your breathing system is in your brain. So if your brain doesn't function well, you can breathe, you can protect your airway, your gag reflex will be affected, and that's a problem for this patient. And this is acute mental status change. Confusion also come here. Patient will be confused. Okay. So these are like a bunch of buzzwords I put together just to put you in a focused state. And then the last one is P. It's my favorite because it's very confusing. Every patient that comes in will have a pain, some form of pain, like 95% of them. But not every pain is important, okay? You're looking for pain that will affect their life, okay, and their limb. So life, limb, and eyesight. So if you think this pain is they're going to lose their leg, they're going to lose an organ, they're going to lose something, then you got to do something about it. If this pain, they're going to lose their eyes if you don't do anything about it. Yeah. If you have migraine headache and you have pain in my eyes, migraine headache never caused any problem with my eyes that will make me lose my eyes. But if I have glaucoma, acute onset, well, if you don't do something about it, I'm losing my eyes. That pain is more important than a migraine headache. And the life, okay, if you don't do anything, they die. Like somebody with the chest pain, from cardiac chest pain, you got to do something about it, otherwise they die. Somebody with the PE with chest pain, if you don't do anything, their airway, they lose their airway, they die. So life, limb, eyesight, They like to trick you. They'll give you a post-op patient with severe pain. Well, then another patient who has pain that they're going to lose their life, I'll choose that patient more than that. So in summary, BESHARP, not expected, is a tool, okay, toolbox, okay, made up of tools. You just go in to find a tool that will help you fix a problem. Basically, you see a bunch of patients and they give you a question about one patient or a medication, or they give you a patient about procedure, and then you see, okay, this procedure has been done. Which one I have to prioritize? Which one is really bad? I have to do something about it. Okay, that they want you to intervention, teaching, and everything. All of them, you see, is it a priority function? Is it one of these things? Is the patient going to be lactated? Confusion, all these things, you can use it for every aspect of your prioritization. You just have to go back and say, is that related to this? They're not going to tell you once again, the patient in shock. Okay, but you have to make the deduction and then move forward. So that's that aspect of it. This is how you prioritized. Like I've said before, everybody talk about ABC. I think ABC does not let you think critically to analyze the patient, to figure out the diagnosis, and then to critically think that this diagnosis is a problem. There's certain buzzwords that will give you the diagnosis away. So that's why I don't like ABC. I want you to think and say, hey, if I have this medical problem with this kind of signs and symptoms, is it more important than knowing that I have a C problem or A problem or B problem? No. The best way to prioritize is to be sharp. And being sharp is to focus on this diagnosis, this list of diagnoses, and pay attention to them and look at them the second time. And you keep it focused as you prioritize throughout your exams. Even whether they give you medication, you can look at this medication and say, these are the list of symptoms. Which symptoms is more dangerous than the other one? That is being sharp. Take care of yourself and good luck in your exams. And check my website for more details of this topic. And all comments are welcome. Thank you very much and have a blessed day.